That's about it.
Okay, so when you actually go to a hospital, right, what is the thing that you think, whether in terms of model or a product, differentiates yourself
So
from?
basically, we have two products. One is enterprise, where we actually push in the whole, like we just go and install a server with our software, and from all the radiology, they just push it in.
No, but what how do you differentiate yourself from, as you know, there are, at the cursory level, of course, there are a lot of PACS players, but you should be having something that differentiates yourself
Yeah,
from that. Right?
let me put it this way. The Benz also does the same thing, and even Maruti 800 does the same, right? So we are mostly like the Indian guys, right?
So what are you, the Maruti 800 or the Mercedes?
So we does the same thing. Yes, but we don't, like we are a startup, so we know our weaknesses and we know our strengths. We are technologically strong. So what we do is, the biggest challenge IT has is installation of software. Let's assume the EMRs or the teleradiology, right? Let's say I have a hospital where there are 100 computers. Imagine installing a PAC software in 100 of the PCs.
Yeah.
It's a nightmare. Convince, or just imagine a doctor, right? He goes home and he just switches on his Mac. Ours works on Macs, Linux, everything. So it doesn't matter. It just needs to be some browser in it. So he just goes in, he just logs on, or he just goes to a net cafe. We don't know, right? So he just goes there and he just pops in. So our biggest advantage, what we differentiate is no installation required for PACS. So with full-fledged
Client side, that's
yeah,
for the
client
doctor.
side. Yeah, there's no, you can just like plug in and go. For the 3D, it's required because I need access to the GPU. Okay, so the graphic card. I mean.
Okay. Mohan, for the enterprise software companies, right, what do you see as is there a market that's evolving in India, or it's still like fragmented and small like before?
What we see in India is quite fragmented. There are a lot of small companies trying to sell enterprise. Only last 2 years I'm seeing companies which are developing solutions based on cloud, which can, basically what it enables is the doctor and the patient and the second opinion, etc., need not be in the same place, right? So I think it's still, I would say, early stages. It's very early, not even 2%. So I think the growth is still to come. A lot of projections I see India like $1 billion to $1.5 billion healthcare technology, which is HIS, EMR, cloud PACS, remote monitoring. I would say today is less than 100 million. Yeah. Big hospitals like Apollo, they adopted, but it's not the other ones. Still billing system, HI is a billing system. So that's a challenge you'll face is while we go ahead and try to sell, the selling cycle will be longer, okay?
Yeah, actually, most of our teleradiology clients, they're slowly converting themselves into PACS clients. They just start the cloud. Once they get used to it, right? Many of them have become the enterprise system.
Yeah, one thing I'm seeing is the rental model is being adopted, so bring the price down very low, right?
Yes.
Start 5,000 rupees a month, work with a broadband provider, bundle it, okay? Provide the basic feature, and as adoption happens, you add more and more modules. So I think you have to start low and then build your way up. That may work better.
Okay.
Opportunity. In the next 5 minutes, I'm a pure clinician. I love to deal with my patients. I'm a psychiatrist by profession. I now call myself as a medical health entrepreneur because I've learned some hard ways and tough ways, and this is a journey which I would like to put across. Startup and innovation, and I think I would like to first of all make a point here. Is healthcare business very different from the other businesses? Think over. My answer is, it depends how we see. Because if a healthcare company makes a lot of profits, how do we assume the profit to be? Is it because they make more money? Is it because they're giving good efficiency? It's very difficult to tell. We know healthcare is evaluated not just by about bottom lines and top lines and those. There are a lot of proxies. Is the toilet clean? Is the nursing staff taking care? Is the lift operator doing good job? Are they courteous enough? Is the wheelchair available next? So there are a lot of proxies which decides how healthcare is delivered. I'm talking about delivery of healthcare. At the end of the day, anything is at a delivery level. So positioning, how do we position as healthcare? With a brand or with trust? I think it has to be together. There is some kind of a balance we need to bring in. As I already mentioned to you, I'm one of the founders, and the other one is Dr. Sharmita, who's sitting there, who's also a healthcare professional. So I'm a psychiatrist and she is a public health professional. What made us start up something in the mental health sphere? The answer is very simple. We used to give simple solutions, like have a common ID, let's use Excel sheet, some simple things people used to reject. We used to find it difficult. The next thing was, we thought it's high time that we face the challenges by ourselves, take the lead. And one of the thoughts is to leave behind a trail. When we are no more there and we are only in the photos, could we leave behind a trail is a simple question. And I think we really want to do that. And I think I'm proud of what we are going about now and the way we look forward. Healthcare is definitely going to move around in some direction. We know which direction, nobody knows, but we hope it's going up. What is Augmenta Health going to do? The budding Augmenta Health is going to take care. Even though we started in 2011, maybe we were sleeping or maybe we are thinking too much. We didn't do anything for about 2 years. We just started and kept it. With all hard-earned money of our family members, we could pull in about 42 lakhs, which is about a 2 BHK house, which everybody would buy. We thought, okay, let's invest, as if we are very rich. We still rent a rented house, but we thought it's high time that we put in. The reason was very simple, I'll let you know. The vision we have is very simple, creating healthy communities by designing healthier minds and enhancing well-being. Because I was astonished to see, I was there for last 2 days, hardly mental health was hardly even mentioned. But we all know mental health is sheer important. So what are we wanting to do as a mission? We want to promote mental health and well-being, both the treatment, illness, well-being, everything, and give very good quality care at affordable costs. More importantly, we are wanting to create a safety net. Create a net where people can go back. In India, we know we don't go to psychiatrists. We go to aunts, uncles, relatives, and friends. But we are losing the culture today because of various reasons. Can we create more sensible safety nets? And why did we focus mental health? The answer is very simple. 1 in 4 adults have some psychological issue which needs help to be addressed. 10% of the disease burden is because of mental health. $16 trillion is the amount of money which is going to be lost because of mental health issues in the next 20 years. Don't even ask me how many zeros come there. I don't even know that. The real reason is very simple. We thought it is our expertise. Let's focus on our expertise. Let's not try to jump into too many things. That's the simple reason. We created 3 divisions, 3 steps, and 3 successes I would like to share in the next 30 seconds. We have a clinical division called Couch, which takes care of outpatient facilities. Only one center is there in Bangalore. One Day Guru is the teaching and training, which takes care of professional help. We empower other medical professionals learning more about mental health. PH is the public health initiative. We ensure that money which is spent is calculated. The reason is very simple. We have limited money. And out of the 42 lakhs, the best part of it is we have stored it into a land which is about taken out 2/3 of it. The rest of the money is what we are juggling around and try to create innovation, but we don't go behind. All of it we use is into online, taking care, database, save everything and all the stuff. And we want to create a culture of helping people dealing with these things. The 3 simple successes are very easy. We have just recently filed our income tax filing and those things. We have already touched the positives. Before tax, we have already been able to reach profits. We hope it will scale up even more further because without any marketing, we are able to do it. If we start doing rest of the stuff, I'm sure we are going to grow. A lot of people in the industry and outside start looking and ask, how come you're able to run the show? I think we are able to raise eyebrows, which means probably we are doing really wrong things or really good things. We assume we are doing the good things. We are very, very proud to be one of the finalists in one of the awards which they had taken over. We are in the final 3 of the outreach program. We are India's first online suicide gatekeeper training program. And it's a suicide prevention program which was developed by us. No IT software engineers, Sharmita and me, midnight, sitting down, coding WordPress codes and those things. We did it with a cost of about iPhone 6 Plus. If you had missed the Flipkart, you will pay costly, but otherwise, that's the cost we spent. About 65,000. It's on and running. It will run forever with the same cost. You don't need to pay anything. It can be highly customized and scalable to the next level. That's where we are. And well begin is half done. I think that's not enough for us. One thing I would make a point clear here is we are very sure that someone is paying. Every action someone is paying. It's a patient, it's the doctor, it's the funders, it's the investors, somebody. So I think we need to be really accountable for the money which is transacted in healthcare. That's something which we are always looking at very seriously. And we only want to focus on mental health. We really do not want to go into anything else because we have enough jobs to be done there. So we have expansion models in terms of mental health literacy, clubbing, hub spike model of consulting we want to develop. But we definitely want to focus on complete healthcare in mental health. Promotion, prevention, treatment and rehabilitation, drug de-addiction. These are things which we are definitely looking at. Intention, connection, and execution and adaptation always requires teams and funds. I, as an individual, cannot do anything. I'm always looking forward for good liaising with working with people. Instead of pitching this, when people told you should pitch, I say I don't pitch. Let's talk. Let's join together and have a great journey. Welcome aboard. If anybody thinks you have an idea in similar areas, let's work together. Let's leave behind world a great place. Thank you very much.
Yeah.
Yes, sir.
In this one, what's the business model right now? Like,
we have 3 ways of revenue generation. One of the revenue generation is by running the outpatient service, which is only one currently. It's a full-fledged outpatient service, which takes care of the psychiatry, counseling, therapies, and other things. The second way of generating money is by delivering a lot of training programs, specifically targeting a lot of other colleagues and doctors. We run, as the Helpy, which we spoke about, suicide care, we run a free program for the doctors who can register and learn about mental health. It's called as I Love Brains, where we share about passionate cases, videos and those things which talks about it. And we also generate revenue through it, significant amount of this thing because we are liaising with a lot of training institutes and those. That's the third. The third thing is the public health initiative which we have done, which is free for the end user. They don't need to pay. Anybody can access through it online and go to the website and register and become a suicide gatekeeper. You can prevent suicides. What we are looking at is when we customize, we look to tie up strategically with NGOs and other people who like to work on, we might see at delivering them the baseline material, infrastructure which is required and training which is very difficult to get. That's what we are looking at, sir.
Lisa, one question. Like in the US or anywhere else in the world, do these kind of mental health solutions, do they kind of work outside of traditional hospitals and care providers and so on and so forth?
Yeah. So let me just say that there is a tremendous amount of economic loss related to mental health every year, and nobody knows how much. And the problem is that if you can't measure it, then nobody really sees it as a loss, but there's a real cost involved in implementing a program, so people focus on the cost of the program instead. In the US in particular, there is a much more increased focus on wellness, and mental health is certainly a part of that. And outside of I think that there is an opportunity for programs like this to be marketed to hospitals themselves. And I think that they could be very much seen in conjunction with diabetes treatment because we, in particular at Henry Ford, see a lot of depression and a lot of, again, lost productivity associated with chronically ill people. So there is an opportunity, I think, but again, you have to kind of figure out the cost model, who will pay, how will the payer be identified, whether insurance will cover it or not, all of those things.
Okay, thank you.
Thank you very much.
Okay, the next one is Cardiac Design Labs.
Good afternoon. Okay. So I'll just set a quick context here, and then we'll explain the product we're developing. Okay. So this is a slide on the data on India. So very specifically, this would also map to the growing economies. We have about 64 million cardiac patients in this country, 90% of these actually are going to small hospitals. There's a small number which actually goes to the regular big hospitals which provide the diagnosis and the treatment. And this is primarily because of the landscape and where these hospitals are recorded. So India today actually only treats acute. This is because the resting ECG machines, which are predominantly used in most of these hospitals, actually only look at data for about 10 seconds. And if the condition is acute, it's going to pick up and you do the next level of treatment. So you're actually waiting for most of these patients to actually come to that stage of acute, and then treatment is provided. So when in a city hospital, when an affordable patient walks in, he has access to doctors, cardiologists, and they have access to devices which can actually diagnose the patient a little early. They have these Holters, event monitors, and then you have the treadmill test, which is used to analyze ischemic patients, which is the coronary artery disease. So what are we talking about is, in cardiac design labs, try to create a scenario where these small hospitals are able to diagnose these patients frontline, be able to filter these patients more effectively. Very simply because we have about 4,000 cardiologists in this country to 64 million cardiac patients. Anybody's guess as to how many patients actually reach to a cardiologist. So you need to get the right patients to these cardiologists so that their time is used effectively. And the next level doctors, which are there across, are able to actually do the first level filtering. So this makes an effective system for actually management of early detection and disease treatment. So how did we go about this? So when we actually looked at the large hospitals there, these Holters and treadmill tests and event monitors, these are all fairly expensive equipment, apart from the resting ECG. And there was a protocol in which they were used, and they were developed at a different point in time. We said if you have to bring that kind of diagnosis down to a smaller level, we will need slightly different kind of devices. First, you don't have technical know-how in these small hospitals. You do not have trained technicians who are sitting there. Second, the cardiologists are not there. Third, very importantly, they cannot pay the big money. So you will have to do it in a much more affordable cost. So what we ended up doing, we developed a comprehensive ECG analysis system. How did this happen? We actually looked at, so we worked with doctors along the way, cardiologists. We developed these algorithms in such a way that these rings run real time on small mobile devices. It can be a phone or a tablet, and a certain hardware that is worn by the patient, which is actually fundamentally the ECG pickup. So why is these things complicated? Very simple. The resting ECG is called resting because you have to be absolutely at rest. Taking an ECG from a resting patient is fairly simple. You have good, clean data from the heart, good for analysis. Once the patient moves, it gets complicated, which is called the ambulatory ECG. You have noise, you have other kind of problems that come into the ECG. All these require correction. These corrections are done at software, involve complicated signal processing. Then the next level. Even if you have got a certain segment of ECG, now, how do you present this to the cardiologist? You cannot take all of this ECG to him. He does not have that kind of time. So you need to do some kind of filtering that happens and says, get to the conditions and say, these are the ECGs you should look at. So we built a full clinical engine into the software, which can actually do the analysis and tell you where to look at. So we were able to do resting ECG, we were able to do full ambulatory ECG analysis and the stress test analysis, which is the ST segment, particularly to the ECG, which helps you analyze the coronary artery disease. We were able to do all of this real time, and now the cardiologist is not there. Even if a patient is monitored in a small hospital because he or she walked in with some symptoms, you need the final review to happen through a cardiologist and reporting being done. So we added effective telemetry into this. Very simple. We were able to bring it through to simple apps that the cardiologist will use. So at the end of the day, when they're actually going home, they can actually look through maybe 10 or 15 patients that have been monitored at different small hospitals in peripheries, and they're able to identify an active patient. So there's two-level filterings have happened before he actually finally took it. So this is the system. It has a body-worn device and a tablet or a mobile that goes with it. Both those are at patient side. Then we have the cloud server and some remote apps which complete the workflow. So right now, I'll just show you how simple the system is because I'm actually wearing it. I am doing Holter on the go real time. I'm able to give all the features that a complicated GE or a Philips Holter is able to give you on this simple device. And it has a full workflow with the remote apps that can actually complete a complete diagnosis remotely. We are the first company across the globe to actually give you this comprehensive diagnosis. This is 12-lead diagnosis. I'm just wearing the full, all the 10 electrodes that form the 12 leads to give you this diagnosis. So what is happening? What are the key propositions that are coming? We're moving this primary cardiac advanced diagnosis from large hospitals into smaller hospitals. There's a pretty large number. It'll have a big impact where it goes. We are doing this. We have actually test-bedded this with doctors. They're able to use it. We are doing this without call centers, full-blown call centers, because the traditional event monitors in the market actually generate a lot of ECGs that go online. Somebody has to filter them before a cardiologist looks at it. We're doing all this on software. So primarily, this will be a very good scalable model, if at all the minimal level of call centers that can be built in. So we'll be able to take on much larger client base with reach to diagnostic centers or small and medium hospitals.
Since we are running short of time, can you get to the summary part of it?
So that's about it. So that's a comparative chart that tells you on the right is the large hospital, on the left is the small hospitals, the three large diseases that we have mapped. You see the kind of names that I've shown there. There are the different manufacturers of Holters, event monitors, and resting ECGs. You see on the left column on top, small and medium hospitals have nothing today. They just have the resting ECG machines for acute CAD. They don't do any of this. With our system, you will be able to start looking at that as a market.
Mohan, just one question. From what you see, do you envision a scenario where there could be a big medtech company that can be built from India? Like, because the big guys are coming down, the small guys are going up, all of those is happening right now.
I don't know with kind of mission. What I can say is medtech combined with services, okay, probably will be a
so actually,
larger market
that's the
than a
other
purely
part
a
which I
medtech.
didn't come
Yeah.
to.
Yeah.
We are doing a pay-per-use model. We would actually deploy the device, we'll load a virtual wallet with prepaid model, and deduct per diagnosis that's happening.
Now, what he meant is also the clinical service also, right?
Yeah, the actual, because somebody needs to guarantee, yes, if I'm a patient,
Yeah.
I am critical care, I need to make sure that it's available, right?
Yeah.
Okay, so some doctor services can guarantee me, if and when there is a problem, I am guaranteed within like, the first golden period, somebody comes and helps me, or tying it up emergency services, maybe a larger revenue model. You know,
Yeah,
look, it's,
so
I think
now
it's the
we
right
are
direction, unless we go down, drill into the deeper into the problem and say, how you tie the medical devices with the services, with the doctors, patients, how does the money flow, right? And that's when you get a large business.
So right now what we're doing is trying to talk to some of the larger hospitals before going down, or we try to plug into the existing ecosystem of the referrals that they already have, and we connect those doctors in. So the system actually fits into the existing manual system that they have today.
Sure. Okay. Thank you.
Thank you.
Okay. The next one is Acaster Technologies. And since we are really running short of time, it would really help if we can wrap it up in 3 minutes.
Sure. Good afternoon to everyone. I am Mrs. Deepti Verma, the Marketing Director of this organization, Acaster Technologies Private Limited. So it's a social enterprise, and our vision is very social. Our vision is to solve the basic problems of the society all across the world in the healthcare by doing the groundwork in the technological innovations. So our journey has started with a burning problem which is the need of the society, that is 78% of the population in India are not getting quality diagnostic services. And the reasons are very simple. We didn't have a proper technology which can sustain Indian environment, Indian conditions. What are the Indian conditions? There is a power problem, there is a transportation problem, electricity issue, and above all the affordability. Accessibility and awareness is the one major factor, but more than this, affordability is the major factor. So we know from the beginning that the solution is very clear, that we need a technology which is made for India, which is as per the Indian conditions only, which can sustain the remotest locations, rural locations, different climates of our Indian geography. So it is Mr. Amit Bhatnagar, who is an IIT engineer. He has taken this initiative and has revolutionized the novel technology for the diagnostic services. So he has brought a very beautiful solution for our country that is called Mobile Lab. So it's an entire laboratory in a suitcase. It's a lab in a box with the power backup. What we have done, we have miniaturized the whole laboratory into a suitcase. We have a semi-auto analyzer into this, the centrifuge, incubator, micropipettes, all the components which are required to run a laboratory. And on the top of it, it has a backup because of the battery and solar panel. So with the solar panel, it can run continuously for 24 hours. So it is a one-stop solution. We have all the things in one suitcase. The technician, lab technician can take these machines anywhere and can go anywhere in the field and can do the testing right over there and give the reports on the spot. So what we have done, we have also added a software solution to it. So you can see the laptop is connected to it. So we have a Bluetooth connectivity as well as the USB software, USB port. So all the information from the analyzer the laptop and the patient information is available on the cloud. So even patient can access his report, and the organizations who are using this technology in the field, who have deployed these machines all across the rural areas, they can see the real-time data from their head offices. So this is the list of tests. These are around 36 blood tests, which involves glucose, hemoglobin, lipid profile, liver function test, kidney function test, and hematology. So this is the kind of report format which comes. It gets auto-generated in the software. You will have your logo and the list of the patient with the data, with his reports. So these are the features which we have just mentioned. It's very rugged, portable, and it can sustain all the rugged temperature. It can work from 0 degree to 50 degree centigrade, which means it can work in Leh Ladakh region as well as in Jaisalmer, Rajasthan region without any stringent working condition. It doesn't require any air conditioning. It doesn't require warm-up time, cooling time. Nothing is required. So technician can do the testing anywhere. So this is the satellite control. So now when we are working in the field, so the quality becomes very important parameter because the technicians are working in the field and there is nobody on the top of him to supervise him. So what we have done, we have added a mechanism called satellite control. Through satellite control, we can assure quality, we can assure financial control, we can assure real-time data transfer. Without internet connection, we can have a minimum basic information that has he done the quality control today or not. The basic quality control is the protocol which any laboratory has to follow every day. So we can have that data every day without even internet connection through on our phone systems or on our internet system, even on our mobile phones.
Can you go to your last summary, please?
Sure. So we have a patent for this technology. We are funded by Technical Development Board. This technology has been also recommended by Ministry of Science and Technology. Even the Ministry of Health and Family Welfare has approved this under the guidelines of free diagnostic schemes. And it has been awarded as one of the best innovation by President of India, Shri Pranab Mukherjee. These are the certifications, USFDA, ISO, CE, you can see. So at the Acoustics Technology, we believe in the holistic approach. One is the disruptive technology which we have already built. Now we believe in skilled manpower because wherever we send this machine, we need a manpower. So we are coming up with training centers. We are trying up into skill development ministry, and we are bringing the unemployed youth. So what we will do, we'll make the unemployed youth into a empowerment. We'll empower them with this machine, and then the banks can finance them and they can use it, they can start their own labs. And then here on this platform, we need a strong network because we cannot reach each and every place. So we need a strong network in terms of we want to tie up with the corporate CSR, under the CSR activities, the governments, NGOs, foundations, telemedicine services. We can reach all remote locations. Sure, sir. Okay. So this is our objective which we have already shared. So this is the running cost is very low. This is one of the beauty of our machine because we are doing at the doorstep. The running cost is very low. The glucose you can see 90 paisa and hemoglobin 18 paisa like this. And then this mobile lab can be utilized at all these places which are written here under telemedicine, at the remote health centers, the mobile clinics like this. So this is our latest innovation. On the mobile lab, we can do only 36 tests, and at the same time, we need a vehicle to carry it to the remote area. So we have come up with the bike innovation. So it is a complete laboratory. On the bike, the technician go itself at the doorstep and can do the testing right over there. And it has a portable, foldable tent, table, chairs, all the facilities is there. Now it is also come with ECG, microscope, and the blood pressure, temperature, all these tests are included in this, other than 36 blood tests.
Hi, I'm Anurag. I'm the founder of KidNurture. Yeah. KidNurture is a software platform for pediatric caregivers such as parents, pediatricians, and developmental pediatricians. The most important keys in child growth and development assessment is timely detection and early intervention. And somehow those areas are which are suffering a lot because there are some obvious problems like parents don't know exactly what are the red signals they need to observe and raise during their well child or vaccination visits. Normal pediatricians are supposed to do some level of monitoring during well child visits, but somehow they are not able to do due to lack of helping tools in time. And at the same time, developmental pediatricians use very complex tools to assess, which already consume a lot of time. And due to that, most of the pediatricians rely on clinical judgment, and that's what a study says in United States, that around 70% children who had some kind of behavioral disturbances or developmental delays, they went under the radar. They were not identified by normal clinical judgment. So KidNurture is a one-stop solution to address this problem. It provides automated pediatric tools to all caregivers across different nurture segments. So once you create a child profile here, you get a complete nurture profile across different nurture segments from growth, development, immunization, nutrition, or physical examination point of view. Each caregiver gets a different set of tools as per his or her role in childcare. If it's a parent, they can record normal milestone, growth-related data, and system will show them any red flag so that they can raise that problem during next visit to pediatrician right in time, and based on that, any early intervention can be introduced. This is how parental login looks like. As you can see, different areas with the collection of tools applicable to parent as well as certain tips and related information is provided to them. A normal pediatrician get tools appropriate to his or her practice. That is normal developmental assessment or normal growth charts for WHO or Indian Academy of Pediatrics, those kind of charts and other physical examination. This is a normal pediatrician kind of login I can show you. And similarly for developmental pediatrician, we have automated many copyrighted complex tools which require a lot of time for generation of reports, like a checklist for autism or ADHD and other developmental assessment things. So as you can see, these are India-specific tools like Trivandrum screening scales as well as developmental assessment scale for Indian infants. So these are, So these are like certain complex reports which require mental age or developmental quotient calculation, etc., which is being done by the software automatically. So from market perspective, there are around 300 million children in India, 30 million added every year. So there's a huge market opportunity, 70,000 pediatricians and other therapists which make our other market segment. For revenue, we are charging medical professionals for annual subscription, and we plan to add this module to other HIMS-based solutions because that is the module which is missing from any EMR solution right now. From parents, we want to monetize that community when it grows big. Right now, it's free sign up for parents to record the data, to book appointments, to share their information online with doctors, and at the same time, doctors can share the information online as well. In terms of achievement, we developed this product with detailed research and feedback from from taking that feedback from the experts worldwide, from leading Indian institutes also. So they have given the permission to use their copyrighted tools, etc., in our system. Some paying users are not on board now because we made it live just last month for the pediatricians, and we are now also building the API-based module to integrate it with the other HIMS solutions. Currently, the product is as per...
Yeah, if you can just wrap it up, though.
Yeah, sure. So right now, we are seeking help from funding perspective as well as mentorship and network. So our goal and mission is to make KidNurture the platform of choice for pediatric caregiving in the future. Thanks a lot.
We are SmartRx. I am Madhivanan here. We are a mobile health platform delivering care management and telehealth. We started off as a patient engagement tool, and now we are well entrenched in care management and trending towards telehealth and remote health. So what we do is simple. We try and solve these three problems. Patients and users who have issues in terms of accessing healthcare or consultation, or it could be simple home-based medical needs, right? We try and solve their problem, thereby saving time and also making it cost-effective for them. Number two, we try and improve care delivery. How do we do it? We play the role of a care manager for them, which is probably not existent in the present healthcare model as we see. Because the doctor, of course, prescribes and gives the instructions in terms of what the patient needs to do, but whether these are followed by the patient is something which is not known until the patient comes back to the doctor and tells what he has been doing and what has been the progress. The third one would be better engagement and outcomes, right? So this is something which is not necessarily as a patient that one needs to be doing. Even when a patient is fit and he is wanting to improve his health parameters and outcomes, he can adopt the platform and the tool, and thereby making himself a more healthy person and being more productive to the society and to the family. How do we go about delivering these three values, right, that we touched upon? So improved access. So we have a set of features and tools by way of which we enable and facilitate access for healthcare consultation, and it could also be through way of e-consults. And e-consult is something completely a mobile-based solution. The user or the patient can get a preliminary opinion and or a second opinion kind of a thing through the mobile itself, and the doctor on the other hand also is going to be available on the mobile app. And once the appointment is fixed, the payment, everything happens on the mobile itself. There is no need for a web version or a web solution on this, right? And you can also order tests, diagnostic sets, and home care medical needs can be ordered online. Personalized care plan. So we talked about care management. So what happens in the post-discharge or in the chronic care situation is that the doctor would probably write out a discharge summary and tell these are the things that he needs to be doing in the rehab and in the post-operative situation until he comes up for the next follow-up visit, right? And then it is up to the patient to follow it, and how much of it is following it is left to the patient itself. But in our case, what we do is, by a mobile interface, we make the content available for his disease-specific condition, right? It could be a total knee replacement, or it could be convulsions for the child, or it could be gestational diabetes, right? So all this information specific to that condition is made available to the patient or to the parent or to the attendee of the patient, and it is available at their fingertips, and it is always there on the mobile. Besides this, what this does also, it can also be highly useful for non-smartphone users, because these care plans by itself will prompt and trigger push notifications. On day 3 of discharge, what the patient is supposed to be doing. If he is supposed to be measuring the blood sugar levels, that will be sent out as a push notification, and he will do that, and he will be able to record that on his mobile as well and bring it to the doctor for the follow-up consultation. Yeah. So the third aspect is better monitoring. So you have all your third-party reports as well as your healthcare provider reports can be collated in one place against your name, and it's available right on your mobile, and you can carry it wherever you go, and you get consulted in wherever city you are. So just a bit of information about our company. We are a startup incorporated 3 years back, based in Bangalore. And we are innovator in the mobile technology platform, and we have 1 million users, and out of which 20,000 patients are paying for our care management service, and we are growing at a rate of around 20 to 30% every month. We have a product which is built for the US market, which is called the Care Bridge, which acts as a care manager. This is how the mobile framework of ours looks. The first one is the home screen, the second one is the e-consult, the third one is the care plan templates, the fourth one is the personalized health records. So the current model is we partner with hospitals to roll out this service under their banner. So it's for the patients, it's typically seen as being run by the hospital itself. Going forward, we would be partnering with other channels and also going direct. So the typical monetization is upwards of 200 plus if it is just care plans, and if it is going to be packaged with other features like e-consults, lab reports and all that, it could go up to as high as around 800 rupees.
Yeah, if you can just finish.
So this is the last one, and I think we have a team of, core team of 5 people. Anil is the founder CEO, I am the COO, and we have the engineering head. And we are funded by 3 entities, Startup Health of US, and IIM Ahmedabad, and Venture East Hyderabad. Thank you. I'll be able to take
Just
any
one very quick question. In the model that you mentioned, even when you're tying up with the hospital, are you providing the services behind the scenes, or is
Yeah, so we typically end up running, even though we provide an admin dashboard and create an account to the hospital, asking them to run the service by themselves. Typically, we end up running the service for the hospital from the back end.
Okay.
Yeah.
Thank you.
No problem. Life, learning, and living before disease, decay, and death. We've been hearing a lot, so I think it's my task is made actually easy, because the keynote speech yesterday by Dr. Rob Jesse started off by saying that individuals need to handle their health. And also, Tushar made it very easy for me, talking about preventive health. And Mohan talked about bringing efficiencies in the medical or the healthcare ecosystem. That is what we actually do. The 3 things that Medioctor, the modern healthcare platform, does. 1, it basically connects the individual with the entire healthcare ecosystem in a unified process. I think the key word here is process management. At the time of being connected, it delivers intelligent contextual content for each one of these stakeholders to make intelligent decisions. And as a consequence of it, the 3 things we have heard, a plethora of technologies, a plethora of devices being talked about. So the one thing that is missing, and not just in healthcare, but in most industries, is integration between health, medical, and information technology. And those are the 3 things that we end up doing on the Medioctor platform. In terms of, I'm really not going to spend time talking about any of our mission or vision, but essentially, I think the one key thing that we keep talking about, we talk about health, and then we talk about medicine, and we talk about hospitals, and we talk about doctors. The primary focus of Medioctor is first and foremost to get an individual to understand that health is a personal management process. And that should be something which is from the time that a person is born till the time that a person dies, that he or she is able to manage their lives more responsibly with respect to health. In terms, and again, product architecture, one of the key things that we've talked about, and this is something that concerns everyone, there is a great amount of discussion about security, so we built in identity and access management. This is perhaps for the first time that it's going to come up anywhere in the world. Process management. Essentially, we talked about, there is a lot of discussion that's gone on about how content and knowledge can be reposited, and we intend to purpose it using metadata in terms of being able to manage it at the time of transaction. And essentially, one very important thing that I would like to sign off with is the fact that we keep talking about big data, and we also keep talking about business intelligence. But what's absolutely key, especially in healthcare, is cognitive intelligence, which is this experiential intelligence, which essentially gets developed when you're able to work on an electronic health record, which becomes the only true guide, which is basically data that's generated from birth until death. Now, I know the questions that can come up is, how does this happen? That what we tried to do, we are a company that started in January 2012, and we started development in April. I'm sorry, I lost that. We started 2015. I'm sorry, I lost track of time. January 2015, we started development in April 2015, and what we have done is we have tried to prove our concept by going to a village. 100 village, 100 people, 100 hospitals, 100 doctors, 100 nurses, 100 pharmacists, 100 pharmaceutical companies, which is Satanuru in Mandya district of Karnataka. We adopted the village. We are creating 10,000 electronic health records of the inhabitants of the village. And in the process, we are training more than about 5,000 volunteers who are also creating their own health record as a means of developing in training the villagers. What we want to prove here is that when you have your health record, and then as a consequence of it, we also launched a cycling event to generate funds. So we just didn't want this to be a tokenism. We want to be able to raise funds, and whatever we come up with in terms of, we already know that waterborne diseases are the key. There is tuberculosis and there is HIV/AIDS. So essentially, we want to be able to generate those funds, be able to bring about a substantial measurement with respect to reducing non-communicable diseases, being able to show how a healthy lifestyle can improve. Why are we doing this? Because the more affluent, the urban, the educated ones are very arrogant to understand the concept of owning health as a personal concept. And by being able to show this from a place that is possibly impossible, make it happen in the society and make the urban, the affluent, the educated, be able to take health responsibly. And if somebody can basically upload on Facebook the daily events of their lives, I'm very certain that if health is really important and it depends, your life depends on it, you will be able to upload your data with respect to managing and maintaining it over a period of time. So our company is not just an electronic health record company. It basically is the base data on which content, knowledge, and metadata can reposit and enable a process to interact intelligently across the ecosystem of healthcare. Thank you.
Yeah, sure, thanks. Tushar, basically, keeping the business model issues aside, what advice do you think you can give for folks who try to use technology to improve adherence, compliance, and so on and so forth, right? Because that's essentially kind of what you guys are trying to do too.
I think the hardest part is getting the users to give and track data. I think that is extremely hard. So most of us, who make behavioral decisions, most of the times are aware of the consequences that are there at a tertiary level, right? But they may not be using that data to make active, conscious decisions right then and there. So to be able to enable that, I think one of the things that helped us certainly is getting users to track what they are doing from a lifestyle perspective and then giving feedback. But user inputs is extremely hard a problem to solve. So, whether it was the person who was getting, diabetes people to track their glucose level, I think you heard compliance issues. It was, the parents' problem as well. Getting users to track is very hard. So the only way to enhance that is by giving extraordinary value to the user for anything that they track. So at least in our company, like if a user gives us data, a data point, it's as important as paying us. So, so whether the user is giving 1 rupee or 1 data point, we consider it as valuable, right? So we give back a lot of value by insights, information, advice, connections, context, etc. So I think increasing the value to input ratio is something that helps businesses and helps consumer behavior too. Yeah.
Okay. Thank you. Okay, the last one is BizInfo.
Good afternoon. My name is Vishwas. We are providing an app-based clinic management solution, and we are challenging the concepts of the cloud itself. Basically, the reason why we are moving to the cloud is because of the cost of the hardware and the maintenance of the IT infrastructure. What if I tell you that I can provide the entire application on a small tablet? I can make the tablet itself as a server and provide the clinic management software on the tablet, and through which your clients, basically your client as a doctor, as a patient, or as an admin or reception can access this server. So that's a concept that we're using, that we are running the application software on the tablet and giving the facility of access of this application by the patients, doctors, and the reception admin. So what does this software do? It does the scheduling, prescriptions, billing, record keeping, and yeah. So the concept here is very simple. There is a tablet on which the clinic management software is running. 247 Doctor Care is the name of the software. and which is accessed by the doctors, patients, and admin. So what patient does is whenever he wants to book an appointment at any point of the time, he just opens his app. He has to download an app. So he books an appointment. It can be done through SMS or an app or through web also. And he has so many other features. You know, he can see the history of his appointments. He can see the history of the progress that he has made, etc. Doctors can view their appointments for the day or any specific day. The doctor can reschedule their appointments and inform the patients about the rescheduling of the appointments so that patients can rebook on a different date. Then they can configure the working hours. If they are working from 2 to 5 with a time slot of about 5 minutes for every patient, they can break the time and make that time available to the patient. And that is published on the server, which can be seen by the patients, and based on when the doctor is available, patients can book appointments. And he can set availability, and then there are in-app applications. Then admin can do a lot of functions. He can register the patients, they can create the billings, he can manage the drug inventory, billing, admin scheduling, and inventory management. So all these applications are available on a simple tablet, which can be accessed as an app by those 3 clients. So this is a typical picture of by a patient booking an appointment with the doctor. You can see the screen there. And you can book the appointments through SMS or through web. These are some of the screenshots of the web. A doctor can give the e-prescriptions. They can do the e-billing. The reception or admin can do the e-billing. And this is our roadmap. Right now, we are in the phase 1. We introduced this product about a couple of months back. And there are some pilots happening. There are no customers in India, but there are 2 or 3 pilots happening in Singapore and Malaysia. In the second phase, we want to give a comprehensive clinic inventory management and medical device integration. In the third phase, we want to integrate to an EMR and also to a feedback system with the patients. Thank you.
Okay, thank you. Okay, so I think that concludes the set of startups that we're presenting. So I think thanks a lot for Tushar, Mohan, and Lisa for helping us out with this. And I think, Arvind, I hand it over to you for the concluding piece.
Madhu, thank you very much as a token of our gratitude to the panelists for taking your time. And we really enjoyed your presence here, enjoyed having you here. A small token of our gratitude, a memento to each of them, please. Ladies and gentlemen, thank you. Thank you very much. We've enjoyed bringing the 6th edition of the Transforming Healthcare with IT to you. We've enjoyed the hospitality of the city of Bengaluru. And I must say, you've been a fantastic audience. Thank you very much. A big hand to all of you, please. Thank you to my organizing team. Without you, I'm sure nothing in the stage would have moved. Thank you very much. Please do send your feedback to us at the scientific committee sc@transformhealth-it.org. We'd like to hear your views. The 7th edition of the Transforming Healthcare with IT will be presented to you in the wonderful city of Hyderabad at the High Tech Convention Center. We'll announce the date shortly. Mark your calendars. We look forward to seeing you at Hyderabad next year. Thank you very much.